Good afternoon. Hello and welcome to Creighton's celebration of National Public Health Week. Our guest this afternoon is Dr. Leah Casanave, who is the supervisor of the STD Prevention and Control Program at the Douglas County Health Department. Good afternoon, Leah. Thank you so much for joining us.
Hi, how are you?
I'm doing really well. Trying to stay inside, to be safe and be healthy. Can you share with our audience a little bit about your background?
Sure, happy to. So my background is I received actually my undergrad degree is from Creighton, and it was in bioethics and Spanish, which my parents couldn't believe when that happened. But
Go Blue Jays!
yes, Blue Jay for life. But then I ended up going and doing my master's in public health and then continuing to do my DRPH, which is a practice-based doctorate in public health, specifically in epidemiology. So those were kind of my focus areas when I was going through school. And for those watching, just starting to get involved with public health. So epidemiology is really we look at how diseases spread. So we try to determine how quickly they're spreading, why they might be spreading, and how we can kind of contain that. So that's kind of our role in a nutshell, but it really goes from there, and it can be branched into several different other areas.
Okay, thank you so much for that. I'm sure that information was really useful to our audience. So in terms of disease spread, the entire world is battling COVID-19. On March 11th, the World Health Organization declared COVID-19 outbreak a pandemic. What does that mean, and how do epidemiologists figure into this scenario that we've all now found ourselves in?
Yeah, so we actually at the health department have been keeping an eye on this stuff for quite some time now. And when the World Health Organization deemed this as a pandemic, that basically means that this virus has affected everything worldwide. So we hear of stuff that's an epidemic, that means it's higher than normal in your usual area. So for example, in my area, I'm in the STD world, but we have an epidemic of STDs in our area because it's higher than the average, higher than where we typically see our numbers.
Okay.
So pandemic is when we're seeing something worldwide that's higher than normal.
I see. Thank you so much for that. So we have now, so this is a worldwide spread of a virus. Yep. How is the STD Prevention and Control Program working with the other departments in at Douglas County Health to fight COVID-19?
Yeah, so that's a question that happens a lot because typically people wonder why I'm getting brought in, and that's kind of how we're organized at the health department here in Omaha. Is we have an epidemiology and preparedness division that houses my office, the communicable disease office, our vital statistics office, and then our emergency preparedness group. So the four of us all have very similar backgrounds. A lot of us do a lot of epi work in our day-to-day basis anyways. And so with my background and the folks that are kind of reside in my program and do our typical daily work is very similar to what happens in the communicable disease epi program. So a lot of my folks that work with me have been pulled over in assisting in the COVID-19 fight. And even my role, we've started doing what's called an incident command system at the health department. So we have our director who's kind of in charge, and then it trickles down and we've all taken different roles. So one of the roles that I've kind of assisted with is our communications role. That involves anything from creating flyers that you might see up on our website and getting the right information out to the public, making sure that we have it in languages available for everyone. We're getting a right message out to folks when it comes to social media. making sure that we're kind of tackling some of these issues that we can, and then also creating a good internal communication within the health department staff.
I see.
So we kind of branch all over, but the reason
Yes.
my group's been brought in was because we're so similar in the work that we do with our communicable disease group.
I see. So it's really an all hands on deck kind of effort over at Douglas County Health Department.
Yes.
So speaking of that, all hands on deck, exactly, if you could, just maybe give us some of the highlights of the efforts that the health department is making with respect to containing this spread of COVID-19.
So our group, I guess I'm trying to think of the best way to split it up. So our communicable disease group has really tackled doing what's called contact investigations. So all of those folks that are testing positive are being contacted by what's called a disease investigator. And those folks are then asking them all the questions of where did you travel? Who have you been around? All of that good stuff that you typically think
Yes.
of when tracing back where people have been to determine who may be potentially exposed. And so we're getting to the point where we've got over 100 cases now. And so trying to, we've only got so many people that can do this work, and they can only handle so much in a day. And a lot of my staff have been dragged over into EPI to do this because they do that with our STD work. So
I see.
Yeah, so that's been one big piece that's taken up a lot of time, but then we've also been working with our public health lab. And in the beginning, our supervisors and division chiefs were the ones approving the lab testing that was going on. So they were getting calls at 12:30 at night, 2:30 in the morning, 4:30 in the morning, every day when this first started happening. And now that tests are starting to become more open and more available, I guess is the better word.
Yes.
So we haven't had to do that piece as much, but we've got the contact investigations, we've got lab coming in, really just working to try and contain and get the message out about staying in, social distancing, and this whole flattened curve that everybody's been talking about.
Right. So can you talk a little bit more about that? Because that really is the message that we're getting from various media. Social distancing is really important because we need to flatten the curve. What does that mean, and what does that mean? We'll get to.
Yeah. So that's kind of what we've been telling everyone. If you look at our website and even in our internal communications that I send out every day, we call these non-pharmaceutical interventions. So that's kind of what these social distancing, washing your hands, doing your elbow when you cough, or coughing into tissue and then throwing it away. Hand sanitizer, all that good stuff. These are all things that don't require any drugs, any pharmaceutical things. It's stuff that we can all do. So we've been telling folks that because there's a story, and this happened a while back, but when the 1918 flu happened, we look at a tale of two cities. So we've got St. Louis, and I think it was Philadelphia was the other one. So Philadelphia didn't take any precautions, didn't have anything, and basically what you do is you see this kind of curve, and it peaks real high because they didn't take any of the efforts into place. They didn't close down their theaters. They didn't stop folks from gathering. So that caused this huge spike in our number of cases that happened. Now, when we look at St. Louis that did it, they decided to close their theaters and kind of limit how many gathering spaces were available for the public. And you start to see that their curve kind of flattened, and it may have been a little bit wider, but it was maintainable. And so the idea between flatten the curve is that we can maintain that level of caseloads, and our hospital systems and all of that can maintain what's going on rather than having this huge spike where we're not able to take care of our folks in the hospital system. So we're hoping that we can manage this until a vaccine comes out and then start to drop that curve.
I see. That's really helpful. Even though, those terms might be familiar to our audience, I think that explanation, and thank you for the story, because that I think really would allow our audience to understand the importance of social distancing and the connection between social distancing, flattening the curve, and reducing the number of persons, I suppose, who would have adverse effects to this illness. Are there any other steps that Douglas County Health Department is taking with respect to COVID-19?
You know, all of our programs have all kind of done different things in order to practice what we preach. So for my group, we have stopped doing any outreach testing. Our STD clinic has closed to basically just doing express testing and calling in prescriptions for people. We're trying to avoid the amount of foot traffic that's coming into the health department.
Okay.
Our food and drinks folks that are doing inspections, they've limited the amount of inspections that are going on, and a lot of them are doing different things around the health department to kind of help chip in where they can. So we've got different people answering the phone lines and doing an information line for the public.
Yes.
And then we've got different folks calling and giving test results. We've got our other areas that are kind of pitching in and helping where they can. And so really, we're just trying to do everything we can. We're working on doing social distancing ourselves when it comes to the office. You see, I'm working at home and
Yes.
working with my group to try and limit the amount of people that are in our office. We try to keep it to at least half. And, you know, I rotate folks in, say, okay, I know that people need to get stuff done in the office, so let's rotate who's going in on what days and try to make sure that we're being cautious of how many people are around and keeping our distance from people, just so that we're keeping those at-risk people safe.
What are some of the things that people can continue doing while still observing social distancing?
So I would say some of the things that, you know, we put out even on our social media pages is that, you know, you can do I think Netflix has parties online now. You can go for a walk, especially if there's someone in your household, go for a walk. Just if you're walking by, try to keep that distance between you and others when you're on a path, or if you walk to a park, keep your distance at the park and don't congregate in groups. Make sure folks are 6 feet apart from one another. We've been seeing a lot of folks doing that. And so we want to just reiterate and tell them that it's fine to go out and it's fine to walk and get the sunshine that we all need, and just make sure we're keeping that distance from people and being in a safe zone, sort of, if you call it that, between one another. Other things that can be done, you know, we help folks, especially if you're at risk. A lot of the grocery stores and I guess like Target, I think, is one, but a lot of them are doing morning hours for those that are considered high risk. So if you're over 60, yes, expectant mothers, have high risk comorbidities, you know, they offer that time for those folks to go to the store and get the items they need.
Yes.
We don't need to hoard things. We just need to get what we need to live for the next week, 2 weeks. We're telling folks to keep enough for yourself for 2 weeks in the house in case for some reason you do get sick.
Okay.
We don't want you to have to leave for 2 weeks. We want, when we say you start to show symptoms, you know, make sure that you stay in your house, stay quarantined for at least 14 days.
Okay. Okay. So really, even though it is a time of high anxiety, Douglas County Health Department is encouraging persons to perhaps try to be as normal as possible in terms of their shopping patterns, their grocery patterns, in terms of their socializing, to limit that to going out for walks while keeping their distance, not congregating. So yes, it looks a little bit different than it used to.
It'll look a little bit different for the next couple weeks, but we want to make sure, because we know that a lot of the stuff that we're getting, especially like on our information line, mental health is a big deal. And that's a topic that we all need to address and normalize. And we have resources up on our website for mental health. A lot of groups around Omaha and Douglas County are offering a lot of emotional support lines. If you're having any kind of issues, please call these people. You know, we all have issues going on. And I think it's safe to talk about it and say that these are stressful times. And we all have to learn how to kind of deal with this stuff in our own ways. And those people are here to help.
Yeah, That's really good advice. I just wanted to ask you one last thing about groups at risk. Um, there are a lot of young people in Omaha as a consequence of Creighton and UNO, and I think that there might be a sense that if you're young, you're somehow not at risk. Could you just talk a little bit about that?
Yeah. So a lot of the times we see, the folks that are at risk are 60 and above with comorbidities, expectant mothers. So a lot of the times what we're telling folks, especially these younger folks that are in town and out and about, they may not
Mm-hmm.
think it's going to affect them, but they
Mm-hmm.
can carry the virus and it can transmit to those that they may care about. So we're telling folks, act as if you're the one who's sick and you don't want to get others sick.
Okay.
That's kind of the mentality to take when you're out and about, because even though it may not affect you as much, we're really trying to protect others in our community to make sure that they're safe.
Okay.
If you've seen some, I'm sure people have seen people posting pictures like "stay home for us" and "flatten the curve for
Yes.
us." It's basically protecting everybody else by
Yes.
doing our job of staying in and distancing from people. There's still ways
Yes.
to be social. I mean, we can still do FaceTime and Google Hangouts and Zoom meetings and whatnot. So we can still do all these things and talk with people and have those interactions. We just may
Yes.
not be able to have the physical contact with people that most people are
Right.
used to.
Right. Right. Okay. Well, Leah, thank you so much for taking the time to chat with our audience today as we continue these informative sessions to celebrate National Public Health Week. I would just like to let our audience know that in addition to this video, we will also be posting a link to the Douglas County Health Department page that has lots of community resources listed on there that you might find helpful as we continue to flatten the curve.
Yes.
So thank you again. Thank you again, Leah.
Yeah, thank you guys. And thank you to everyone that's going into public health. That's kind of what we want folks to go into. So very excited for this.